Welcome to this explainer. Hearing the words, "you have breast cancer," is a moment that just literally changes everything. It's an incredibly daunting diagnosis. But today, we're going to walk through it together, step by step. We're drawing on the expert insights of Dr. Akiko, a highly experienced breast cancer specialist and surgeon, to map out exactly how modern medicine classifies, targets, and treats this disease. Our goal? To bring you some much-needed clarity and comfort through understanding. Because when you or maybe a loved one first get that diagnosis, perhaps you found a lump or got a callback from a routine screening, that immediate reaction is almost always just overwhelming panic. And hey, that is completely human. But what is the very first thing you should do? You just need to take a breath and seek to understand. As we'll see throughout this explainer, breast cancer is actually not a single uniform disease. Your absolute strongest weapon against the fear of the unknown? It's actionable knowledge.
Okay, let's dive into this. Here is our roadmap for today. We'll move through 5 clear steps. First, understanding cancer classification. Second, separating stage and grade. Third, exploring local versus systemic treatments. Fourth, the vital importance of appearance care. And finally, choosing your treatment plan.
Starting with Section 1, Understanding Cancer Classification and the Importance of the Needle Biopsy.
Right after identifying a suspicious lump, your medical team is going to perform a needle biopsy to understand the exact biological makeup of those cells. Like we said, breast cancer is highly personalized. Doctors are basically looking under a microscope to find out what essentially feeds the cancer cells. They're checking for hormone receptors, meaning the cancer uses female hormones to grow, and a specific protein called HER2, which promotes cell growth. Based on whether your tumor is positive or negative for these 2 factors, doctors categorize breast cancer into 4 main types. And this classification is literally everything because it dictates the exact, targeted medicine your doctor will use to treat you. Now, this classification process brings us to a frequently misunderstood term: triple-negative breast cancer. So the crucial point is that this simply means the cancer cells tested negative for all 3 common receptors: estrogen receptors, progesterone receptors, and the HER2 protein. That's it. It just means the cancer doesn't rely on those specific mechanisms to grow. I know if you search triple negative online, you might find a lot of terrifying information suggesting it's an automatic worst-case scenario. Well, actually, scratch that. Dr. Akiko's data paints a much more reassuring picture. Overall, breast cancer survival rates are very high. And triple negative isn't just one single thing. It's a massive umbrella that includes a whole variety of forms. In fact, especially in older patients, triple negative can present as a relatively mild, slow-moving form of the disease. So please, don't let internet myths dictate your outlook. Look at the facts of your specific biology.
Moving right along to Section 2, the difference between stage and grade and understanding size versus aggression.
And this brilliantly illustrates a major point of confusion for so many patients. You see, the stage, which runs from 1 to 4, simply measures progression. How big is the lump? Has it reached the lymph nodes or other organs? But the grade, running from 1 to 3, is an entirely different story. Dr. Akiko uses this fascinating visual metaphor here. She calls the grade the bad face of the cells. When you look at them under a microscope, grade 1 cells look relatively uniform and calm. But grade 3 cells, they're highly irregular and look biologically aggressive. So you could actually have a stage 1 cancer that's very small, but a grade 3 cancer that is highly aggressive, or vice versa. They measure 2 totally distinct things. All right, Section 3, local versus systemic treatments and building your customized attack plan.
Once we know what we're dealing with, your medical arsenal is broken down into 2 distinct categories. First, you have local treatments, like surgery and radiation. These are focused entirely on the specific location of the tumor. Think of them as the snipers, eliminating cancer from one highly targeted area. Systemic treatments, on the other hand, include things like chemotherapy, hormone therapy, and antibody drugs. These therapies travel throughout your entire bloodstream. They are your comprehensive defense system, hunting down absolutely any microscopic rogue cells that might be trying to hide anywhere in your body. Let's move to how this actually shapes your surgical choices. Obviously, the ultimate goal of any surgery is always reducing the cancer cells to absolute 0. Now, if the lump is generally under 3 centimeters and the remaining breast tissue can maintain its shape, breast-conserving surgery is a fantastic option. However, for about 5% of patients who have genetic breast cancer, removing the entire breast, a mastectomy, might be recommended from the start simply because the chance of a totally new cancer forming in that remaining tissue is much higher.
But beyond surgery, there is this massive, incredible wave of innovation happening right now in systemic treatments. Pharmaceutical companies are pouring resources into incredibly effective new drugs. Honestly, the most exciting among these are antibody-drug conjugates, or ADCs. Think of these as smart bombs. Instead of flooding your whole body with toxins, these highly sophisticated drugs are designed to hunt down the cancer cells, attach directly to them, and deliver the medicine right to the source. It is an exciting, powerful new era of targeted medicine that offers immense hope.
Section 4. The importance of appearance care. Because we have to treat the whole person, not just the disease.
Now, as effective as modern treatments are, they definitely take a physical toll. But science is finally tackling one of the most feared side effects of chemotherapy: hair loss. Now, what's really interesting about this is how we use scalp cooling caps. By wearing a cap that circulates extremely cold fluid during your chemo session, the blood vessels in your scalp constrict. This literally blocks the chemotherapy drugs from ever reaching the hair follicles, drastically reducing hair loss. Plus, for those needing mastectomies, breast reconstruction, whether using silicone implants or the patient's own tissue from their stomach or back, is fully integrated into treatment plans today and is even covered by insurance. It's a real game changer.
Finally, Section 5. Choosing treatments confidently through shared decision-making.
You know, having all these advanced medical options is wonderful for sure, but they only work optimally with clear communication. Dr. Akiko offers a vital piece of advice right here: speak up early. So often, patients in Japan and all around the world might hesitate out of politeness. They'll just agree to whatever the doctor suggests initially, like a full mastectomy, only to admit right before surgery that they really wanted to try breast conservation. Listen, doctors want to build a plan that respects your personal boundaries and desires, but they cannot do that if you don't voice your wishes right from day one. Please, do not hold back out of politeness.
Crucially, those conversations with your doctor have to be grounded in reality. Your treatment choices should be based on correct medical facts, not random internet rumors or horror stories from decades past. You might hear an old story about how brutal chemotherapy used to be, but modern side effect management, including advanced anti-nausea medications and those scalp cooling caps we just talked about, makes today's treatments far, far more tolerable. Don't let outdated fears make your medical decisions for you.
Well, we've covered a lot of ground today, from the microscopic face of a cancer cell to the cutting-edge smart drugs used to destroy it. And if there's one thing you take away from this explainer, let it be this final thought: knowledge is your absolute best partner in treatment. A breast cancer diagnosis will always be scary, but when you understand the classifications, when you know your options, and when you communicate openly, you step out of the shadow of fear. You are no longer just a patient, you're an active, powerful participant in your own recovery. So what questions will you ask your doctor tomorrow? Keep learning, stay focused, and take control of your journey.